name's Emily Bradford, and this is my Foley catheter video, part 2. Hi, my name's Emmy. I'll be your nurse today. I'm just going to raise the bed to working height. Can I see your wristband, please? What's your name and date of birth?
Ashley Walczyk, 9/27/2000.
Okay, perfect. That matches my records. So on your chart today, I have an order for a Foley catheter. Do you know what that is?
No.
Okay, so basically it's a tube that I'm going to stick up your urethra into your bladder, so it will help with voiding. Do you have any allergies to shellfish, iodine, or latex?
No.
Okay, perfect. And I'm also just going to make sure that there's patient privacy by closing the curtains and making sure that there's adequate lighting. So now I'm just going to put on my gloves. And at this point, I would perform pericare on my patient, but for testing purposes, I don't need to. And I'm just going to move your legs, so it'll be better for your Foley catheter. Just let me know if it's uncomfortable at all for you. Is that okay?
Mm-hmm.
Okay, perfect. Okay, so this is my Foley catheter. It's a 14 French. It has 10 milliliters of sterile water. It has expired, but for testing purposes, that's okay. And I see no rips, tears, or moisture on the package. So I'm just going to use this as a trash bag. I'm just going to set it down by your legs. Okay, so I'm just going to start by pulling this away from me, pulling this away from me, side, and this side. Okay, perfect. And then I'm going to use my 1-inch border to move it to the correct area. And then I'm going to take this, nav the shiny side towards me, let it drape down without it going below my waist. And then I'm going to place it for my patient. Okay, perfect. And now for testing, I'll be using my own sterile gloves. So this is a size 7. It expired of April 2018, but for testing purposes, that's okay. I see no rips, tears, or moisture on the package. And again, my table is very small, so for sterility, if this hangs off or if it touches that does break it, but for the circumstances, it's okay. And I would also step back more, but since my room is a little bit small, and I've already put on my sterile gloves, so I don't need that. I don't need this. I'm just going to move this to an appropriate area. And right now I would attach my syringe to my Foley catheter, but my syringe is broken, so I'll just pretend that I clipped that on there. And then I'm going to take the end of my tube and lubricate it. Put this back on. So my patient is a female, so I would start by cleaning by opening the labia and going from the meatus down. But since it is a water bottle, I'll just use a circular motion. So I'm going to hold this and have it secure. Go around. And the tweezers nor my gloves should touch the bag while cleaning. Again, my arms should not go over the cleaning area because that can break sterility. Alright, and then I'm just going to put there. Okay, so now I'm going to begin by putting in the tube. So I'm going to start by putting it in with positive pressure. I'm going to go all the way until I see urine and then go 2 inches more because this is a female. And then I'd secure the catheter. And then again, my syringe should be attached, but since it's not, we'll just pretend it is. And then I will now begin by inflating the balloon with 10 milliliters of sterile water. And then I would detach the syringe. And then I would take this out. I would ask the patient if that was tolerable, and then wash my hands. And then I would also put on a new clean pair of gloves and put the leg strap on my patient and then secure the catheter and also put the bag on the side of the bed. But due to testing purposes, I'll just leave it like that. And then I would also document the odor, clarity, amount, and color of the urine, and then make sure that my patient is comfortable. And then wash my hands on my way out. And then now it's 3 days later. I'll wash my hands again. Hi, my name is Emmy. I'll be your nurse today. Can I see your wristband, please? What's your name and date of birth?
Ashley Walczyk, 9/27/2000.
Okay, perfect. That matches the record. So I was your nurse a couple days ago and I inserted a Foley catheter, and now it's time to remove that. Please let me know if you're uncomfortable at any moment. I will put on some gloves. And then I would begin by putting my blue chucks on the ground and putting my cylinder. And again, my bag should be on the side of the bed, but since it's not, I'll just demonstrate how I would unclip these. So first I would just unclip the green part and then unclip this part and then drain out the urine. And then I would clip it back together. Take my gloves off since they're dirty. Wash my hands again. And then put new gloves on. And then I would also put the blue chucks and the urine that has been drained under the bed so that I don't spill it or step in it. So now I'm just going to start by deflating the balloon. So I would attach my syringe to this while having this secured. And I would start by, well, this should be an active process, but for testing purposes it'll be passive. So I'm just going to deflate the balloon by myself, getting 10 milliliters of sterile water back into my syringe. And then this should be attached, but we'll just leave that here. And now I'll begin by taking the catheter out. And then taking my gloves off. And taking all my trash away. And then I would ask my patient if that was tolerable and I would also document that I removed a 14 French Foley catheter, and I would also document the odor, color, clarity, and amount of urine, and I would inform the patient for the next few days of voiding to let us know, just in case we can see signs of infection such as a UTI. And then I would also ask my patient if they would like pericare, and then ask them if they're all comfortable, and yeah, wash my hands on my way out, and then I'd be done.